One of the areas where I work is in policy development and working with various political leaders to look at how we address American Indian issues, specifically in the health arena. And I think that one of the biggest challenges that we face in Indian country is that many of our political leaders don't understand federal trust responsibility, in that we did exchange a lot of land and resources for these services that are the responsibility of the federal government to provide. And I think that over the last 400 years, we've seen a loss of understanding of how the federal government is responsible for working with and relating with Indian tribes, that there is that government-to-government responsibility. And unfortunately, with our political leaders, generally speaking, having a lack of understanding and awareness of how that system works, we see perpetuation of underfunding. And it's remarkable how many political leaders really don't understand trust responsibility and don't understand tribal sovereignty. I think one of the biggest challenges that we face, there are many big challenges, but another of the big challenges is that there are federally recognized tribes in 35 states in this country. So that means that for 15 states, meaning 30% of the senators, for example, essentially don't have American Indians in their constituency. So trying to convince political leaders that they should be investing resources in Indian health from states where they don't have American Indians is quite a challenge, because it's not necessarily benefiting them personally and their political agenda. So I think we need to look at this from a broader perspective, and again looking at it from the concept of mitakuye oyasin, which means we are all related and we are all connected to each other. That even if it doesn't benefit an individual personally or politically, perhaps we need to look at the broader perspective of integrity and the broader perspective of trust responsibility, and recognize that there are things that we can do in the political arena that could have a dramatic and meaningful impact on improving Indian health. And unfortunately, we seem to invest more resources in the health of impoverished people in other nations than we do for our Indian nations right here at home. And that shouldn't be acceptable to anybody, whether you're American Indian or not. That if we can invest resources in the health of people all over the world, but we ignore and neglect the health of our indigenous people here, that should not be acceptable. And I think that this film has the opportunity to increase awareness, not just among non-Indian community and American Indians, but also among policymakers. And perhaps we could see improvements in the way services are delivered to American Indians. As a result of that, we're seeing a convergence of the best of modern medicine and the best of traditional healing methods. And there are a number of programs that really are models that could be seen as best practices, or at least better practices than what we have done historically. And one of the purposes for this film is to explore and to showcase some of these very effective programs that are merging the best of modern medicine and best of modern science with the best that we have to offer in traditional philosophy and culture. And in truth, the most effective way to work with American Indian people, generally speaking, is when we're utilizing traditional philosophies in our own language and our own perspectives with the best of what modern medicine has to offer. So it'll be important in this film to highlight the programs that are working, because I think there's also a lack of awareness among American Indians, among our own people, regarding what other populations are doing, what other reservations and other communities are doing to address their health issues. And I think by exposing and exploring these other types of health systems, it could influence other tribes to develop model programs and potentially reduce the health disparities that we are facing.